All right, this is the Trauma Bay. Welcome to the Trauma Bay. You'll spend a fair amount of time back here as a third year. We alternate with our trauma surgery colleagues every other week, who is either captain standing at the foot of the bed running the show, or who's Doc Wright standing where I'm sitting, doing the primary and secondary survey and any procedures that might come up.
Yeah, airway doc is something that we do as second year ED residents when we're on the blue team. So you go to all the trauma alert. Usually they're the sickest patients. They're either, they're the ones with abnormal vital signs with the depressed GCS. So as airway doc, you do all the airways for all the trauma alerts that need an airway. They can have those bloody airways. And so it's really, really great and important because these are the true emergency airways.
You get to spend so much time in the emergency department as a second year that you get to kind of pick your poison month by month and do a different technique every month. So you can do preloaded bougie, you can do D-blade, you can change it up, and this is the time and place to do it.
Yeah. And you have an attending, the red doc, the red attending will be there, and they'll coach you through your intubation checklists, and so that you can get that first pass.
So we started our shift, and within the first hour there were 5 traumas, which is not abnormal for a red shift. So I really like that it's a lot of teamwork, and it's a lot of exemplifies how well we work with our surgical colleagues. I think they're one of our favorite consulting services, and I feel like we all feel that way. They're just wonderful.
Somehow, even when you do get a bunch of traumas like that, there's always people who come and help out. There's people who, the trauma team is emergency medicine and trauma surgery, and so there's always someone, who can captain, whether that's EM senior resident, the trauma senior resident, EM faculty, trauma faculty, one of our other seniors who happens to be on maybe our lower acuity area. There are people that we can pull, that we can help out, and when you have all those people come in, all those traumas come in, it's actually, it sounds really cliche, but it's really magical to have, all of a sudden formulate multiple teams, multiple trauma teams, because we're all so well trained and we can all handle that.